Dr. Marion Sloan's looking for evidence of ailments aggravated by air pollution. Very often, she doesn't need to look far. There's overwhelming evidence that the city's air quality is making people ill and shortening lives.
Over the years, you see the change in the illnesses that people come in with. And it's not just an illness of old people. The babies get bronchiolitis, they get wheezy, little wheezers. Childhood asthma is on the increase. In every class of the local school, there must be 3 or 4 children now with an inhaler.
If you live in Sheffield, this report makes grim reading. It claims up to 325 people a year are dying prematurely because of air pollution, and it's costing the NHS in the city £96 million in extra care and medicines. It points the finger firmly at one culprit: traffic pollution. And if you still don't believe there's a problem, have a look at this graph. It shows a year's worth of air pollution in Sheffield with all the spikes on bad days. And that little red line across the middle? Well, that's the government's maximum safe exposure limit. Now Sheffield has to come up with an action plan that'll keep it on the right side of new European pollution laws.
It's really concerning. It's something that as a city we've known about for a number of years. We've had some plans in place. Expectations were previously that we will try to get emissions levels down. Clearly they have not gone down because of the growth in traffic, and clearly we've got a very long task ahead of us, and a hard task.
Back in the 1950s, Sheffield was notorious as a dirty city with poor quality air, thanks mainly to its heavy industry. But in the 60s and 70s, big strides were made in cleaning up the pollution. But now it's back, and campaigners say we're all suffering, not just motorists.
It's their children that's got asthma. It's their grandparents or parents that might have COPD or got heart problems or lung problems, and so it does affect everybody.
Marion Sloan does her bit by using this electric car for her home visits. The challenge now is to persuade thousands more road users to do the same. Alan Whitehouse, BBC Look North, Sheffield.
Alan, thank you. Well, joining me now from Sheffield is the city's Deputy Director of Public Health, Dr. Paul Redgrave. Paul, thank you very much indeed for joining us. Why so bad in Sheffield? I never thought it. You don't, when you go there, you don't realise it's that way at all, do you?
Yes, what we know is that in all big cities there have been problems, there are problems with air pollution. The most notable one has been London, which is why they introduced the congestion charge in London. But that was effective in reducing the amount of air pollution from traffic in that city.
Is there anything to do with the geography of Sheffield? Because it's in a bowl, does that make any difference to the way that pollution builds up?
Yes, that contributes to it, and that's certainly one factor that we know about.
So what do we do to stop it?
Well, this is the big question, isn't it? And I think that what's happened recently is that the amount of medical evidence that air pollution from traffic is causing serious ill health has been accumulating. But I think we've known about this for some time, but what we hoped would happen, and what the traffic planners hoped would happen, is that the new technology around catalytic converters in modern cars would lead to reductions in pollution, but that just hasn't happened. The amount of traffic has increased, and the technical fix, in a way, hasn't worked. And so I think that we are going to have to look at other ways of bringing down the amount of traffic that there is.
Paul, if it's bad in Sheffield, what's it like, in your opinion, in Leeds or some of the other cities?
Well, I mean, I don't have the details of what's happening in Leeds, but I do know that there's air quality monitoring zones in many of our big cities.
OK, Paul, thank you very much indeed for joining us. It's a fascinating subject for debate, I think.